Have you ever wondered why your company's health benefits feel a little less generous each year? Or why your medical bills seem to be climbing faster than anything else? You're not imagining it. Across Asia, a healthcare cost crisis is unfolding, and it's hitting businesses and employees hard, according to a recent global report. While the world braces for a medical inflation rate of nearly 10%, the Asia-Pacific region is facing an even steeper climb at over 11%. What does that mean in simple terms? For every dollar your employer spends on healthcare this year, they'll need to spend about 11 cents more next year just to provide the exact same coverage. Now, let's zoom in on the three countries at the very epicenter of this surge: the Philippines, Singapore, and India. Leading the pack is the Philippines, with a staggering medical trend rate of 14%. To put that into perspective, the country's general inflation is projected at just under 3%. This means healthcare costs are rising almost 5 times faster than the price of everyday goods. Why? A perfect storm of factors. More people are seeking medical care than ever before. The cost of procedures is going up, and a strained public system is pushing everyone towards more expensive private care. Add to that rising doctors' fees and a shortage of healthcare workers, and you have a recipe for skyrocketing costs. The biggest culprit driving insurance claims: hypertension and heart disease. Next up is Singapore, coming in at a close second with a 13% medical trend rate. Now, Singapore is famous for its world-class healthcare, but that quality comes with a hefty price tag. Even with general inflation cooling to just 1.5%, medical costs are on a tear. The city-state has a rapidly aging population, which means more demand for managing chronic illnesses and elderly care. Plus, Singapore is quick to adopt the latest, most advanced medical technologies. These new treatments offer amazing results, but are incredibly expensive. Combine that with high labor and real estate costs, and you understand why premium care comes at a premium price. And in third place, we have India, with a medical trend rate of 11.5%. Again, this is much higher than the country's general inflation of about 4%. The main issues here are rising claims for cancer, circulatory diseases, and musculoskeletal problems. People are using their health insurance more often, and the treatments they need are getting more advanced and pricier. Lifestyle factors in big cities, like poor ergonomics from desk jobs and air pollution, are also contributing to a rise in chronic diseases, which in turn drives up healthcare spending. So, what's fueling this fire across the entire region? Two major factors stand out. First, specialty medications. These are the cutting-edge, often life-saving drugs for complex conditions like cancer or autoimmune disorders. While they're a medical miracle, they can cost tens of thousands of dollars per patient per year. As more of these drugs become available and included in health plans, they send costs soaring. Second, the shift to private healthcare. In many Asian countries, public health systems are overloaded. This pushes people with company insurance towards private hospitals and clinics, which offer convenience and speed. But this high demand allows private providers to charge much more for everything from a simple consultation to a major surgery, and those costs are passed directly back to employers. So, what's the solution? Just cutting benefits or making employees pay more isn't a great option. It hurts morale and can make people less productive. Experts say the real answer lies in a shift from reaction to prevention. Instead of just paying the bills after someone gets sick, the focus needs to be on keeping people healthy in the first place. This means companies need to invest in real wellness programs that target the biggest health risks: high blood pressure, lack of exercise, and poor nutrition. It also means encouraging preventive care, like regular health screenings and checkups, to catch problems early when they're cheaper and easier to treat. Finally, smart plan design can make a difference. Things like co-pays or flexible benefits can encourage all of us to be smarter consumers of healthcare. The bottom line is, tackling Asia's healthcare cost crisis requires a long-term strategy. By investing in employee well-being and preventive health, companies can hope to control these rising costs without sacrificing the quality of care their people depend on. What are your thoughts on this? Have you noticed rising medical costs where you live? Let us know in the comments below. Thanks for watching, and don't forget to like and subscribe for more insights.